In the heart of Southeast Asia, a silent killer spreads unchecked.
They need to get their hands stitched up, like quite a lot of blood on the floor.
Rabies, the world's deadliest disease, can be a daily threat to rural communities in Laos. So together, working side by side with government officials, WVS takes on the challenge to help control its spread.
So here we are, just arrived in Laos. It's warm, it's 9:45 in the morning. Yeah, let's rock and roll.
We have just 96 hours to vaccinate 70% of dogs in these provinces, reaching over 20,000 animals.
We want to do the country's first rabies vaccination program. So if we can crack this province first, show it can be done, we can do it.
This is Mission Laos.
So we've just got to Zoonotic district at the district office. It's day one of vaccinations. We're basically just waiting for the vaccine to arrive because this district's quite far out, so the supply of the vaccine's been a bit delayed, but it's okay. Vaccines are going to get here. All the teams are going to take them out, then we'll start vaccinating. We're going to get out into the field soon.
Roads in Laos, although improving, still have their challenges, making distribution difficult. Led by Ben and Dr. K, the challenge of working in such a remote environment is tough. Importing dog vaccines, which must be kept between 2 and 8 degrees, and then driven for hours across rugged terrain and dirt roads in 34 degrees heat, is not an easy task. Thankfully, after only a small delay, the district received its supply of temperature-controlled vaccines.
So the mission today is going door to door, vaccinating dogs. We won't get all of them, but we have to get 70%.
To get the coverage we need, within each district, teams are working in groups to reach as many dogs as possible, going door to door.
All the vaccinators for this project are local vets, so we're basically training them up to build the capacity of the local veterinary communities, and we've got 186 local vets working across 11 districts just to make sure that we get maximum coverage for this campaign. And by working with a local team like this, it's the best way to build sustainability in the project. They're building up the level of education of the local vets, and then in the long run that's going to continue to improve the local veterinary services. So some of the areas we're starting as a static point, so a static point's where basically dogs will be brought by the community. So we actually have the village chief who's basically going around the villages announcing the fact that we're doing the campaign, and then people will hear about that, bring their dogs to us. Once it ends here and people stop bringing in the dogs, then teams will start roaming. So they're just about to start splitting up and going into their separate areas.
Ben and Ricky help alongside local vaccination groups, giving a hand to any teams who need a bit of extra support. The team must be extra careful with puppies. Being so small and fragile, they need delicate handling and a careful injection. Our Novivac rabies vaccines are generously supplied by MSD Animal Health, who donate them to support the International Rabies Task Force and Mission Rabies. They're entirely safe for dogs of all ages and all breeds, even safe for pregnant dogs. They can be given under the skin or into the muscle, and they provide highly effective protection against rabies. Stopping the disease in dogs is the crucial part of breaking the cycle of transmission of rabies. Dogs are the reservoir hosts of the disease. Over 99% of all human rabies cases are transmitted through dog bites. There are always dangers involved in trying to vaccinate lots of dogs. During a visit to a team in the remote village of Myeon, a call comes in that a dog owner has been bitten during the vaccination.
We're just going to go out to them now, make sure that we give them proper advice on post-exposure vaccinations to make sure that they're protected for rabies. Lady, where's the owner? They've already gone to hospital?
Yes.
Okay, yeah. So we just got to the owner's home. They've already gone to hospital, make sure they get PEP, make sure they get their wounds cleaned up.
The dog will have
Yeah, we can check it out.
Aggression is a very visible and obvious behavioural change that occurs when the dog is infected with rabies.
We also need to talk to the owner to try and ask a bit more about the dog, because we want to know if it might have been vaccinated before or if it's been exposed to rabies. It doesn't look rabbits now. I think they need to get their hands stitched up. There's quite a lot of blood on the floor. Yeah, okay. I say we go to the hospital then. Right, see you in a sec.
The team want to check on the dog bite victim, ensuring they get the care they need. It is vital that they receive post-exposure prophylaxis vaccination, otherwise known as PEP, because rapid administration of vaccine after a potential dog bite can stop the spread of the disease. It's only possible to know of a positive rabies case once it becomes too late.
So we've come to the district hospital where they've come for treatment, and we've spoken to them. We've got a bit of a history of the dog. It's not been bitten by another dog before, so it didn't have rabies symptoms. So it seems unlikely that the dog does have rabies, but we're still going to make sure that the owner goes for their rabies treatment to get post-exposure just in case.
With the dog owner in good hands, Ben can rest easy knowing that this individual will definitely be okay and heal quickly. Over the following days, the WVS crew continue to check up on other vaccinating teams in districts around the province. Some are making such great progress that they're running out of needles.
So yeah, we just got to a district. They've already used up all of their needles, so we're just going to come to a local pharmacy, get more, and then the district vet's basically going to distribute them to the other teams. So yeah, there we are.
The planning involved in running these campaigns is immense. It's months of pre-planning work to gain government approvals, getting supplies into country, and then when the campaign starts, they've got to contact all the local village chiefs and veterinary students, working alongside some incredible organisations such as the Department of Livestock and Fisheries, Provincial Agriculture and Forestry Office, and the University of Laos has been a blessing. And with the immense logistics, training and communication, things have started to come together to try and make sure that this project is a success.
So yeah, we've just got to Hindhut district. We're right up in the hills. We've joined a local vaccination team. They're doing really well. And they've also been joined by the village chief. So the village chief is in charge of the whole village, and she knows where all of the dogs are. So she's basically taking us around from house to house. All the locals know her, so it's a really good way to get good community engagement, and all the people are coming out to get their dogs vaccinated. So we'll stay with this team for a bit, make sure that their techniques are good, and then we'll move on to the next district.
Without the support from the chief, it would take much longer to find dogs within villages like this. And they'd also find a lot more reluctance to vaccination efforts. Thankfully for us, we're able to work alongside the local communities to provide the best coverage we can, reaching our 70% goal. 70% is the number of dogs in any given community that we have to vaccinate to break the cycle of transmission and protect that community from rabies. And just in time, Ben gets a phone call about those needles.
Yeah, so we spoke to a local pharmacy, and they're putting an order for the needles, so they're going to be arriving later this evening, so all the teams will have enough for tomorrow. So all good on that front.
After some meetings with government officials, we've got the go-ahead to start planning a country-wide vaccination campaign to try and help make Laos the first country in mainland Southeast Asia to become rabies-controlled and eventually rabies-free. In just 4 days, WVS has completed the first ever mass rabies vaccination campaign in Laos. Over 21,000 dogs were vaccinated, helping to create a buffer zone to protect animal and human lives from rabies, the deadliest zoonotic disease on Earth. With your help, we can continue our work here in Laos and gear up to tackle the challenge head on. We can't do it alone. Together, we can make our goal for a rabies-free world a reality, and we need your help. And the holy grail with this is by 2027, we want to be vaccinating the whole country, ideally in a month's period. Nothing like having an ambition, is there? That's what we've got to go for. You've got to aim big, haven't you? Always got to aim big. So what you need to do is come out on a trip with us. Next year, we're going to need lots of help. There's going to be a lot of dogs to do. So sign up, there's next year, and then from 2027, whole country, do in a month. Pack your bags.